Hi, everybody. We're here with Mindi Messmer. I'm glad to welcome Mindi here today. She has worked with Less Cancer for several years. She has been an Elsie Hillman speaker. She has participated on many levels with the National Cancer Prevention Workshop. For those of you that don't know Mindi, Mindi has really been a world changer and has done much to make her community safer around drinking water and forever chemicals that include things like PFAS. But we're here having this conversation with Mindi today because she has a personal experience that we're going to share today. And Mindi, welcome. Thank you for being here. Thank you for sharing your story. Here you've been out slugging it out for communities and not just communities, but your own community in New Hampshire. And you have gone to the mat fighting to lower risk for cancer. So fast forward, tell me about March. We're well on our way to COVID. Tell me what's been going on since March.
Yeah, thanks first, Bill. I mean, the work that you do, raising awareness about the need to prevent cancer is so important. And I know that you've made a lot of personal sacrifices and professional sacrifices to do that. And the work that you do is just so very important. And as you say, coming from an area where I was working actually as an environmental consultant in industry for a long time and identified a pediatric cancer cluster in my town. And that sort of pushed me into becoming more of an advocate, to run for office, to change regulations here in the state of New Hampshire, not just for PFAS, but for other things that cause cancer, like arsenic, which is naturally occurring. So very concerned about the high rates of cancer. Speed up to then March 27th of 2020. The state of New Hampshire had just gone into lockdown with the COVID pandemic crisis here, and all the hospitals were closed down to visitors. My husband, having come back from a vacation, he never sort of really got better, just sort of incrementally got worse. And on the 27th of March, around 11 o'clock, he came to me and said, I have to go to the hospital, I can't breathe. And of course, having the COVID thing going on, I thought, oh my gosh, he's got COVID. Rushed him to the hospital. I was not admitted to come into the hospital with him. He was brought into the emergency room and treated in the emergency room. I sat in the parking lot with my phone waiting to hear what was going on. Come to find out, I got a phone call from him and his voice was breaking up, that he had leukemia and that they were shipping him down immediately to Mass General Hospital in Boston to be treated down there because of the very acute presentation of his illness. They brought him down to Mass General. I had 10 minutes to go home and grab some of his personal items. I don't even know how I did that. It was so upsetting. My husband was 56 years old, in tip-top shape, wicked healthy eater, really amazing athlete. And to have this come down, in the midst of this pandemic was just a huge blow. And ironically, the kind of cancer that he has, acute myeloid leukemia, is an environmentally triggered cancer. So this have really affected, first my community, which made me get involved, and then the state as a whole with the highest rates of some cancers in the nation. And then it came right to my own house and affected my family in such a way that was just really tragic. And for the next 4 to 5 weeks, he was in lockdown in Mass General Hospital, undergoing really aggressive chemotherapy to save his life. Every one of his organ systems shut down in succession. And he, though, amazingly pulled through that. And in the last few months, he had a stem cell transplant because of the very rare nature of his mutations in the leukemia. That was what the treatment required. And we're hopeful that that will be the thing. But, there is just entirely too much cancer in New Hampshire, entirely too much cancer in the nation. And when we know that there's ways that we can prevent at least a good portion of those cancers by lessening exposure to environmental toxins, this has really come home to my family directly.
I'm so sorry. I just want to touch on one thing. when he was in the hospital, how were you connecting? Were you allowed to visit? Were you on the phone? Was it a FaceTime? Tell me
Right.
what that was like.
Well, I was not allowed in. He was in, first he was in the ICU. He was put on a ventilator for 24 hours. So at the very time when so many people were saying, why should I wear a mask? And they're still saying that now. There was a ventilator shortage, and the physician said to us, it's a good thing that he got sick when he did, because if it had been a couple of days later, we wouldn't have had a ventilator for him. And what happened was, he was admitted and then brought to ICU. And because of the situation, the nurses and the doctors were under extreme stress. I wasn't allowed in. So I had the nurses train his cell phone on him so that I could observe him on FaceTime. And I had 2 telephones. One was trained on him 24 hours a day, on his chest or on him, just because I was so worried about his extreme situation.
I've met he's very athletic. And
he's very athletic.
When did he turn 56?
In May of this year.
So he was 55 when
yes.
he hit. Right. Yeah. Okay.
Yeah.
Wow.
So very young to have such an acute case of leukemia. Generally this kind of leukemia, acute myeloid leukemia, is an older man or older person's disease, not a 55-year-old or 56-year-old.
But the fact that you had to FaceTime him through this whole process is heart-wrenching for everybody, and your boys, of course. That was tough, really tough.
Yeah.
So I know I've been keeping you all in my thoughts and prayers, and it is, it's really been a journey for you. And I think how ironic that here you are out there fighting cancer at every turn, working to lower risk for everyone at the same time, and continued to do so at the same time. Your family was having this incredibly tough time. So I'm certainly grateful for all your work, and I'm sorry that you've had to deal with this journey, but I know that your family is strong, you're strong. This is something that you guys have been amazing at addressing and dealing with. And when I first heard this story, I wanted you to share it because I know there are other people that have not been able to get treatment or see their loved ones, or their family's been really disconnected through COVID. Not just cancer, because we know cancer can blow up lives every day. Right. But the COVID is really oil to the fire, right?
It is, absolutely.
And it is really, really tough. How did you advocate for yourself? How did you best advocate for yourself? For people that might be watching this, are there things that you can share about this journey, about how your family helped themselves and got help?
Well, just trying to figure out a way around how to be in touch with the care, and the nurses at Mass General are just phenomenal. I met them almost every other day with a few personal items, because that was all I could do. They met me in the parking lot, and many times they broke down and hugged me, or wanted to hug. They couldn't hug me. I'm sorry. They wanted to hug me because this is not the way they are used to, having families deal with such, a terrible situation. So they felt horrible. So I think, we have to understand that all of the nurses and doctors are under extreme stress as well. And they're also trying to care for our loved ones. So it is, a very stressful time for everyone, not just us. And we need to do what we can to prevent the transmission of COVID-19 in our communities, so that we can, lessen the burden on our healthcare workers that have to deal with all the things besides COVID all the time, like my husband's cancer. So advocating for him was, just in my way of trying to develop as good as I could a relationship with his physicians with their masks on. And that was a whole other thing. You see the physicians would maybe step into the room and they would be all suited up with their masks on and their Tyvek and their, because they had to protect themselves. They were afraid to approach him because they weren't sure if the testing that said he was negative for COVID was really true, or if they were not, in fact, negative. So, you had to sort of see the physicians with a little bit of their eyes coming through. And, it was quite a long time, last month or two, that I actually saw his physician on a telemedicine call. And I said, that's what you look like. So there's a very big disconnect when this kind of thing happens. These people are more used to, touching people and being with them and looking into
so are we as patients.
Yes.
As patients, we're more connected. And when we most need to be connected, we've been disconnected.
Exactly.
It's brutal. It's so brutal.
Yes. So, the best I could do is FaceTime. And I was, like I said, on it 24/7, watching everything that was going on, or try to figure out what was being said. When there's a distance between the phone and physicians at the door, it was difficult to hear what they were saying oftentimes, or try to figure out how to advocate and not be, making it more difficult for them, but really being a concerned family member that was trying to advocate for their loved ones. So it was a very big challenge. It still is. I'm not allowed to go into any of his appointments still. They're all closed down still. So, it is a pretty upsetting way to have to deal with something that's so tragic.
Right. And now that as you're headed into the holidays, you have to be so careful with family. I know your boys have worked overtime to keep everyone safe, and you too. I mean,
yeah.
It's been a journey because you are out there serving the public. You've had to really do it from behind loose height walls of some sort, and that's made it very complicated. Because people connect with you,
Yes.
they connect with you on social media. You typically do a lot of public speaking and a lot of outreach. So people are looking to you to help fill their bucket and resolve issues in some way at a time when you're juggling a lot of other things. So I'm so grateful for the work that you do. I know lots of people are grateful for the work you do. If there's a way that we can help you, or of ways that we can get this message out, I know your family's quite private, and I really appreciate you sharing the story, Mike agreeing to share his story. And I know it's been really a tough journey, but I'm hoping other people will get help because of this story. We can better help people advocate for themselves. We can give them, support in some level. So if they're navigating this cancer journey at the same time, of COVID, it's really, really specialized. And, I know that you fought every day to get the right attention, and did everything you could to make sure your husband and boys received, the best care and attention the family was getting, and how lucky you were to have nurses that were so compassionate.
And, we were lucky that he was taken to one of the best treatment centers in the nation. Right. And I know that there are others that are not as fortunate or don't receive that kind of care. So I'm, very.
We see how hard we have to work to get care for ourselves and others. It makes me wonder how people who are alone, who are, who have language barriers, who have, other hurdles that they have to deal with. I don't know how they ever do it. I just don't know how they do it.
Yeah, I agree.
Anything that we can do to support you and your good work, please let us know. We love everything that you do to help out less cancer, and we love the work that you're doing to fight for your community and family members to make sure they don't have unnecessary and preventable risk in their community and water. And you really, how many cancer clusters did you have identified? 3?
Well, it's the one pediatric double cancer cluster in the Seacoast.
Yeah.
But there are very high rates of cancer. New Hampshire has the highest rate of pediatric cancer in the nation, as well as the highest rate of breast, bladder, and esophageal cancer in the nation.
Which is so crazy because it's such a pristine looking place.
Well, it's a pristine place where industry has really had its way with New Hampshire, I think. And we're starting to see the effects of that. So, and it becomes
a little bit about industry and some of the issues there.
Some, there's a history of landfills and Superfund sites in New Hampshire where, industry has either brought their pollution to New Hampshire and disposed of it here in ways that we now know is not acceptable, or, industry in New Hampshire has thrived by, creating an economic base in some towns that are lower income. Like for Southern New Hampshire in particular, there's a large industrial source of air emissions, which is contaminating a big portion of New Hampshire with PFAS chemicals, and continues to this very day, which we have been fighting to stop. So, I think New Hampshire's a small state. It does appear to be pristine, but, it has suffered from trying to make its way. Some of these.
That's what makes it so wicked. I've been to your seacoast. I've seen the ocean. I've seen the mountains. So many places of beauty, but dangerous.
Yes. Yeah. I mean,
right.
Yeah. And, the regulation and just, trying to, one of the things that when I was elected to the State House, I just was shocked at the lack of attention to these things like bladder cancer. We had known for 15 years that when the state of New Hampshire reduced New Jersey reduced their exposure in New Jersey to arsenic, their rate of bladder cancer now is about 1/10 of what the state of New Hampshire's is. New Hampshire has the highest rate in the country. So my regulation actually made them match that standard. So hopefully we'll see that rate reduced. But, not only is it important in normal times, to lessen environmental exposure, to make sure that our immune systems are healthy and functioning appropriately. When we really see it is when this pandemic hit. And we're now starting to really understand that these background immunotoxicity effects and cancer and all these things, these chronic illnesses that people suffer from environmental exposure, makes them much more likely to have severe cases of COVID-19. So the worlds are colliding. And so in the background, every day we should be looking at ways to reduce environmental exposure, to reduce the rate of chronic disease and cancer. So that's why the work you're doing all the time and have been doing is so important, because when we get hit with a pandemic or we get hit with the flu, those people will definitely suffer more serious effects from those illnesses if they have a background.
One thing that you get so well, and people have learned a little bit through the COVID experience, is that the tools for securing public health are different than the tools we get when we go to the emergency room, or they're different when we visit our doctor. Tools for public health look like education, they look like policy, they look like they look like best practices. So those are a little bit different, and people have a hard time getting their head around that. They feel almost as if it's like a control issue, but it's not a control issue. It's a wellness issue, a health issue. And those are the tools that we've discovered, like simply wearing a mask.
Right.
It has worked so well to secure public health when people actually wear the mask.
Right.
Or, do you know what I'm saying?
Yes, absolutely.
So it's really been an interesting time to showcase how securing public health can work, and it can work this way for cancer too. I mean, we still lose, several 100,000 people to cigarette smoking. We still, despite having all the information we have, we still have great unnecessary and preventable loss. And we know that, in earlier times, it was all about beat cancer, cure cancer. Whether you've gotten through the cancer battle or not, you're wounded.
Yeah.
You know that firsthand. Everything is wounded. Economic, health, everything. Families get lots of things happen when people get sick. And if we can prevent it, I think we should. And you have really been a great leader in that arena, and we're very grateful for that work. I pray your family gets through this quickly, and anything that I can do to help, please let me know. And I'm really grateful for your time today. I know we've gone way over the time limit, but you're such an interesting person to talk to, and I'm really grateful for you being here today.
Thank you so much. I am so grateful for everything you do every day, Bill. It's amazing, and Less Cancer, and happy to be a part of this. Happy to be able to help spread the word, and thank you so much.
Great. Thanks for all your work.
Thank
Take
you.
care. Yeah.
Bye-bye.